All right, well, good evening, ladies and gentlemen. We are so grateful that you have joined us here tonight for our community coffee here in the city of Fortuna. We're going to let additional folks join us, and we welcome each and every one of you, especially in these challenging times. It's more important than ever that we stay connected. We're going to get started here in just a few moments. We're going to let folks mosey on into the main room here on Zoom. We welcome you. This is our Fortuna Community Coffee. Hey, we want to say thank you. We are so grateful that Mayor Long is with us. We are so incredibly grateful that she's taking time out of her busy schedule and for all of her incredible work on behalf of the city and throughout the county of Humboldt. Tonight, we're also going to be joined with our amazing superintendent from Fortuna Union High School District. Good evening, Mr. Superintendent. It's good to see you. He'll be giving a full briefing from the school district here in just a few moments. And we're going to be hearing from the public health officer. We are very grateful that Dr. Hoffman is here with us tonight. Dr. Hoffman is not new. He is not new to Humboldt, but he is new to the position, and he's going to be giving us an overview on all issues of the coronavirus response here this evening. We're going to welcome your comments tonight, conversation. That's the most important part of this evening's event, which will be getting started in just a few moments. We're allowing folks on Facebook as well to be able to join, and we have a few folks waiting to be able to join us on phone. So we'll take it about another 60 seconds and we'll get this event started. And again, we are so appreciative that each of you, especially during the holiday season, are taking time out of your busy schedules to be able to be with us. If you are joining us on Zoom this evening, we're going to be asking live questions. All you need to do is raise your hand and I will just call on you, and we look forward to hearing from you. If you are joining us on the phone, or if you're joining us on Zoom and or on Facebook, and you want to be able to ask a question, provide a comment, a criticism this evening, we encourage you to be able to use this email address, senator.mcguire@senate.ca.gov. Email us tonight with your questions, comments, and concerns, senator.mcguire@senate.ca.gov. Of course, if you are here on Zoom, we'll be calling on you directly. Or if you don't want to talk, feel free to just hit us up on that email. All right. Again, thank you all for taking the time. My name is Mike McGuire, and I'm honored to be able to work each and every day with you, representing Humboldt County as senator here on the North Coast. And I think that we need to be honest here tonight. The North Coast, California, and this nation, we're facing some challenging times. So many are struggling to stay healthy, and of course, so many are struggling financially. And it's more important, like I said in the very beginning, that we all stay connected and making sure that we're hearing the latest information, whether it's all issues related to the coronavirus, the city of Fortuna, what's happening in our schools. We want to make sure that we are all staying connected during this challenging time. We have an amazing lineup tonight. Mayor Long is here. She is one of the hardest working mayors here in Northern California. Again, we have our amazing superintendent of schools, Glenn. Good evening. He's ready to go. Dr. Hoffman, our public health officer, is also here. And I'm a firm believer that Humboldt County shines when times are toughest. And we are determined and we rally when our neighbors are in need. And this pandemic is no different. And I'll just say, we saw this last week with the Humboldt Holiday Food Drive, where we worked with Fortuna High School students and 5 other high schools here in Humboldt County, above and beyond Fortuna. $45,000 was raised for food for people, and over 10,000 pounds of food was donated. And we just want to say thank you, Humboldt County, for your generous support. All right, one more time. If you'd like to be able to comment tonight, if you're live with us on Zoom, all you need to do is be able to raise your hand. We'll be getting comments, questions, concerns in just a bit. If you'd like to be able to email us, the email address is senator.mcguire@senate.ca.gov. senator.mcguire@senate.ca.gov. We look forward to hearing from you as well. Let's get right into it, ladies and gentlemen. We are going to turn the meeting over to Sue Long. She is the mayor of Fortuna. She is the mayor of the city of Fortuna. She's going to be providing us a full briefing. She will speak for about 5 minutes. I'll give her a 30-second heads up as we get closer to that 5 minutes. Then we're going to turn it over to the superintendent. Then we'll hear from Dr. Hoffman. Madam Mayor, thank you so much for your commitment to this community, to this county. I'm honored to work with you. The floor is yours.
Thank you, Senator McGuire. We do appreciate you taking your time as well. We know that you're probably busier than any of the rest of us right now with everything that's going on. So thank you for being here, and thank you for the rest of the panel and all of the participants who are either on Zoom or are watching from Humboldt Access or Facebook or whatever connection you may have. We appreciate you wanting to know what's going on in our city and participating in our event. So thank you for that. So the city, in spite of COVID-19, continues to work on all of our projects and our, city services that we try so hard to provide to all of our citizens. And we've had a couple really big projects, that Ronerville Road being one of the ones that impacted our city the most, our citizens. And we were able to finish that up in November and had a ribbon cutting. And not only was that a project that saved Ronerville Road by having a concrete culvert installed underneath, but we also worked in fish passage access up and down the channel. So we're hoping that we will see more fish in our creeks in the future. And, it was a long project. It was about 4 or 5 months, and the citizens were really patient. And we just appreciate that we were able to get full grant funding to do that project. And so it did not cost the city anything except staff time, which is pretty darn amazing. So we are in the process of also designing our Kenmore Road Exchange. Some of you have asked about that, know about that. We have hired a consultant to do the design. They're working with Caltrans, trying to figure out exactly what that should look like. That's just basically the first phase. After that, we will have to find funding because we don't have the money to build a $12 to $15 million exchange. So we did get a grant fund to do the design. So that's working in our favor. And then once we have a design and have some public comments and meetings on that, we will work on getting the actual construction funds. The other thing is our wastewater treatment plant is out of compliance according to the state. So we're working on a huge project to bring that into compliance. It involves purchasing some additional land, which we are trying to work into some additional parkland as well as part of that acquisition. And so we're working on some final easements and things for that, and that will be paid for with the reserves that are in our sewer funds. And we'll see how that goes and how expensive it ends up being, because we have been able to keep our water and sewer rates pretty status quo for a lot of years, even though there was a time frame that they were supposed to be raised, and we did not do that. We have been able to sustain our services with the rates that we're charging now. So that may end up resulting in some sort of a rate change in the future, but we don't have any information to pass on just yet as to what that looks like or how much that might be. The city council and staff had been talking about a cannabis workshop, because as of right now, the city has an ordinance that there are no cannabis activities whatsoever allowed in the city. And we had intended to set up a workshop. In fact, we had one scheduled, and then when COVID hit and all gatherings are prohibited, we were unable to do that. So I know that there's still some questions in the community regarding cannabis, and we are going to try our best as soon as it is safe to have some kind of public meetings to get that on our agenda and our schedule. We have not forgotten you people that are concerned about that as well. We did hire a new police chief who is doing a fantastic job working on figuring out what our community is all about, figuring out how he fits into the community, and just bringing the morale of the police department up. And I'm just really glad that he is on board and he's doing a great job. November election brought a few changes. We said thank you to Dean Glauser, who served the city for 16 and a half years. And we welcomed Mike Losey to the council. Mike served on the council from 2010 to 2014 previously, and then he took a hiatus, moved out of state, moved back, did all the things, and now he is ready to settle down and serve his community once again. So welcome to Mike Losey. Fortuna also has a new 2nd District Supervisor, which is Michelle Bushnell. I was able to have lunch with her and Council Member Tammy Trent and Supervisor Rex Bone and our City Manager Merrick Perry, and just kind of go over some of the needs and desires and things that she could help Fortuna accomplish. And so that was, it was good to meet her and actually have a conversation and be able to just talk candidly about all of the issues. Very thankful to the voters that Measure G passed. We went out in 2016, I believe, and got Measure G passed, which is a 0.75% transaction tax that's added to the sales tax, and it's generated about $1.4 million per year in the city of Fortuna, which has really helped our general fund budget. It makes up about 22% of our general fund budget, and it allows us to have additional police coverage, more parks, more services, more programs for youth and seniors and all the things. And so passed with just under a 70% yes vote. So I was really excited and happy to see that. And I also enjoyed being able to knock on doors and talk to some of the people that I don't get to see often. So it was a lot of exercise, a lot of hard work, but it was also very rewarding. So thank you to the voters for that. And we will be looking forward to more projects that we can use those funds for. So COVID impacts. City Hall is still open. Couple of things. Police services are by appointment only. So if you have a matter that requires police attention, say maybe you need an accident report or something like that, please call the non-emergency police number and they can get you an appointment so that you can take care of your business at the police department. And we appreciate your patience in doing that. We just added, today was the first day, in fact, free COVID test lodge. So it's a drive-through. You have to 8 a.m. to 6 p.m. and that will be happening on Wednesdays here in the city of Fortuna. So I think that's a great addition to services that we were able to offer to the public.
We about 30 seconds.
Okay, 30 seconds, dang. Okay, really big push for shop local. You know, COVID's affected our budget. Our transient occupancy tax is way down, which affects chamber and our tourism budget. We really need to shop local. I know it's convenient to do Amazon. I know it's easy to have it come to your door, but if you can find that item in your local stores, whether it's Fortuna, Eureka, Ferndale, whatever it is, please shop local. Those businesses have given so much just in the past months. During the pandemic, they've supported the kids during the Fortuna the Ferndale livestock auction. They've given to the food drive. They've supported the Santa Sleigh program through the Fortuna Fire Department, which has got more donations this year than ever before. Those local businesses are what makes our community great. And Amazon is not going to come when you dial 911. So please do your best to keep it local. And also check out our Holiday Dazzle contest. We have over 60 entries, and we're really excited about that. I think the whole town realized that we needed to add a little bit of brightness to our community and to our world right now, and we have more people than ever have decorated in Fortuna. I don't know if it's because of the contest or the pandemic or whatever, but I'm just thankful that you've all done that. And I think I'm out of time.
Hey, Madam Mayor, thank you so much. We're going to be taking questions from all of you in just a few moments. What we'd like to be able to do, and we'll go to Mr. Weiland here in just a bit. We're going to hear from Superintendent Sinistraro in just a few moments. But again, Madam Mayor, we were talking beforehand. As far as the Holiday Dazzle contest, folks are going all out. Am I correct in that across Fortuna?
They are, and you can check out more information, fortunachamber.com, and you can find the Holiday Dazzle information there and find a little map and how to vote. It's awesome.
Now, are you a judge this year?
I get to do a mayor's choice. We got so many donations. We got above and beyond our prize money. So I actually get to pick a mayor's choice. So yes, I will be out there checking out all the lights and deciding which one's my favorite.
All right, you know who to hit up here. That is Mayor Long. I love it. And Fortuna really comes together. And I think that's beautiful that you're seeing so many folks decorating this year. Thank you so much, Madam Mayor. We're going to hear more from the mayor in just a few moments. Of course, we're going to hear from you as well. That's going to be the most important part of tonight. I'm going to remind you, if you'd like to be able to submit your question in writing, feel free to email us, senator.mcguire@senate.ca.gov. It is in the chat as well. Ladies and gentlemen, we now would like to be able to turn it over for an update, a full briefing from the Fortuna Union High School District. We are so appreciative that the superintendent is with us. He really grew up literally in the district, and there's no one better to be leading it. Glenn, we are so excited that you're with us. The floor is yours. I'll give you a 30-second heads up when you get close to 5 minutes.
Great. Thanks, Senator. And thank you for arranging this event. It's great to be able to highlight what's going on in Fortuna. and really around the county, which is great. So I'm going to explain a little bit about what the district is comprised of and everything like that, but mainly talk about kind of what we're doing for the COVID pandemic as well. The district is comprised of 3 high schools. We have Academy of the Redwoods, which is an early college high school up on the CR campus. We have East High, which is a continuation high school that's located at the foot of 16th Street. And then, of course, we have the main traditional campus, which is Fortuna High School. That's located on 12th Street, right in the middle of Fortuna. We have about 1,100 students in our district. Right now, we have a mixture of options of students and parents to choose from. They can come to in-person classes as well as distance learning classes, or even really an independent study situation as well. At East High, we're about 65% of our students are distance learning, about 35% of them are in person. And of course, these do fluctuate depending on the weeks and things like that too. So I'm trying to give you just some general numbers. Academy of the Redwoods is about 40% distance learning and about 60% in person. They're a hybrid schedule, so they're coming different days of the week. And Fortuna High is around 65 to 70% in person and about 30 to 35% in distance learning. Some of the protocols that we have in place at the different sites or district-wide is we have multiple stations for students to pass through with symptoms checks and temperature checks before they come to school. Also, for example, at Fortuna High, each student that passes through there gets issued a colored ticket for the day, so they know that they've been, so the teachers know that, and staff know that they've been screened to get through. Any students that show signs or has a high temperature is sent home, and they will be distance learning for that day. And then depending on symptoms and stuff like that, they may continue to do distance learning. Face coverings are mandatory on site for the duration that they are here. They do have the opportunity to be able to eat during breaks, but we try to get them to distance themselves as much as they can to be able to eat, because naturally you cannot eat necessarily with a mask on or a face covering. And then any kids with a face covering that are non-compliant, we try to have a talk with them. This is few and far between, is that and if they are non-compliant, we send them home to distance learn as well. So far, we've had 5 total cases of students test positive. I would say that none of which were transmitted at school. There's been zero secondary transmissions at school, at our school district. When we do have a positive case, we are notified either by the parent and or public health. We take appropriate measures there to notify every one of the parents and students of the exposed classrooms and the teachers and such. And we have them quarantine and a distance learn for those students for 14 days. We work in, it's what's been through our county plan that we have, and we've been able to run that through. Some things have changed, and I'm sure Dr. Hoffman will talk about it. Things have changed. We've evolved through the time as more cases do come in. But we make contact with each and every student that is and staff member that is has been exposed. But I think it's an important point to mention that there's been 0 transmissions from school. I think that's a very important point. Testing, currently the county has been great and gracious with staff members from the entire county to block off some times and dates for school staff to be able to go in and get tested as they see fit, which has worked out great. Currently, students have 3 options for learning. They can either take part in person, distance learning through synchronous, or an independent study option for that. I would just say that our staff has worked tirelessly to adapt and accommodate the educational needs of our students. Major kudos goes out to our staff. This has been an adapting time, which I'm sure you guys can understand. It has really changed the dynamics of how we're delivering and how we're providing education. But I would say that our staff has been extremely adaptable and extremely dedicated. And I believe that that's why we've been so successful in what we're doing. We all know that students learn the best in person in front of a teacher. And the district is trying to entertain and allow options for everybody to be able to at their different comfort levels. As you know, our school district is governed by a board of directors that are elected. As Sue said, we just had an election. We one new board member, Immunize is our new board member. We just, matter of fact, about 20 minutes before this meeting started, we had a swearing in ceremony and we had our organizational meeting. Our board of trustees are the decision makers for all of our operations at the district. The way it works is much like the city structure is that with the city council and a city manager, we have a board of directors and a superintendent. We meet once a month regularly. We are the second Wednesday of each month at 6 o'clock. Normally we meet at the Fortuna High School Library, but since March in the pandemic, we've been meeting via Zoom, basically.
About 30 seconds, Superintendent.
Thank you. Our board has had to make some interesting decisions in the last few months, as you can tell. I'm sure we've all been there. These are, remember, these are not easy solutions and answers, but we do have to make some decisions, and not everybody's going to agree, but we're just trying to make the decisions with the best information that we have. We have many students who need services that need to be able to access their education, and those are very difficult to provide via distance learning. And we have had some connectivity issues, and I would just say a shout out to the Rotary groups of Fortuna that they've been able to help us secure some Wi-Fi hotspots for our kids to be able to do that. And we are also in the process of being able to be a one-on-one district, one-on-one device district for every student. It's just, as you can tell, most of those devices are backlogged. So we are awaiting their return and waiting for their arrival. And as soon as we get that, we're going to get those out. So. And finally, I would just say we take the safety and well-being of our students and our staff and community as a priority. And we are grateful to be able to serve and appreciate the trust that our community has given us to be able to educate their students and to take the measures to keep them safe. We believe that everybody is doing the best that we can to get through this. So, and again, thank you, Senator McGuire, for the opportunity.
Superintendent, thank you so much for being with us. The superintendent will be taking questions, comments, and concerns here in just a few moments. We'd like to now turn it over to Dr. Hoffman. Dr. Hoffman is the Humboldt County Public Health Officer. He's going to be focusing his remarks on the coronavirus response. It was a milestone day today here in Humboldt County. He's going to be talking to you about the vaccines officially arriving on Humboldt County soil, and of course, looking ahead over the next couple to 3 months. Dr. Hoffman, the floor is yours. I'll give you a 30-second heads up. We're grateful that you're here and thank you for your work.
Well, thank you, Senator McGuire, and thank you, Mayor Long and Superintendent Sinistero. Thank you, everyone, all of the attendees here, Humboldt residents and Fortuna residents. I'm grateful to be given this opportunity to serve as your public health officer for Humboldt County. As you guys all know, about 10 months ago, our whole world changed. This virus that we'd never heard of, you can't imagine getting away from it now. It's everywhere, it's all around us, it takes over every single day. You know, Humboldt County, when this first started, was in a great position. We were protected by factors of geography to a certain degree, and also an amazing public health department that really stopped the spread of this disease early on. You might remember that one of the first cases in California was here in Humboldt County, and it was our public health department that managed to find that and stop it from spreading before it spread out to our community. That sort of work continued throughout the pandemic. You know, we don't have to go into the details of what all the measures were, we all remember it, but I do want to remind us that we lived relatively well here in Humboldt County up until this recent surge. You know, throughout the summer months, into the early part of the fall, our numbers looked really well. They looked really good. We had a few small spikes here and there, but we really were able to contain this and keep the numbers low. That really changed in the last month and a half. Since around Halloween, and probably due to changes in how we gather and just the colder weather months, having to go indoors more, we started seeing a lot more spread of this disease. So throughout November and into December, we really started seeing spikes in the numbers, and it was concerning. we saw it go from a virus that was being brought in from the outside, from people, traveling. Maybe they went to visit a relative, or maybe they had to travel on business, or maybe somebody was coming here to travel to visit family, or even just to vacation. And we would catch it and we would be able to stop it. And now what we're seeing is that the virus level has gone up high enough that it's spreading easily in our community. And so we went from the vast majority of the virus being from people traveling to now the vast majority is you're going to get it from somebody that you know. And that happened really in the last 6 weeks. So that's what we're seeing with the spread of this right now. What that means is that it's much more difficult for us to contain it because there's so much more virus here in our community. And I'll just take a minute to talk about how that affects people. I mean, most of us, if we get this disease, are not going to get that sick, and that's a fortunate thing. But it's also a very unfortunate thing because many who do get it will potentially get very sick. And what we're seeing right now, as you probably all know, at the Granada skilled nursing facility, is that it managed to get its way into that facility, probably through a staff member or a visitor who was visiting their loved one and didn't know they were carrying it. And it spread extraordinarily quickly through that facility. Our first case there was just in the beginning of this month. And now we have over 97% of the residents were positive. We've had many deaths. We have several ill folks, and we have folks there who would love to see their loved ones, but they're not allowed to. And it's a horrible, horrible situation. And this is exactly what we're trying to prevent. So how do we prevent the spread of this disease? There's, the things that we all know about, the things that are obvious because we talk about them all the time. We use face coverings, we distance, we avoid gatherings. Those are the things that we ask of you as the residents of Humboldt County to help stop the spread of this disease. There are things that we're doing as public health as well that you might or might not know about. We do something called contact tracing, where anytime we have a positive COVID case, we contact that person and we start asking them, who have you had contact with? And we try to let all of those folks know if they had a high-risk contact, that if they just stayed home in quarantine for 2 weeks, that would stop the transmission of the disease right there. And then the person who's sick, we ask them to stay home for 10 days until the disease has passed so that they don't continue to spread the disease around. So we call that investigations and tracing. Another big part of it is Superintendent Sinistero mentioned is testing. One of the things that allows us to keep schools open and safe is a lot of testing. The more we test our community, the more we know where the virus is and where the disease is, and then we can stop it. So it's a really important part. If you, if you're having trouble testing, if you aren't feeling well, contact your doctor, get tested, or go to one of our sites like Mayor Long mentioned in Fortuna. Now we're doing mobile collection there once a week. So we're trying to make it as easy as possible. We're expanding testing as much as possible. It's a really important tool that we have to get this disease under control. So why does this all matter at this point? Because we're really at the surge right now. We're at, hopefully, this, we're not sure yet. The cases just haven't been going up, but, we know that when the surge happens in cases, we see a delay of about 3 weeks before we see really the peak in illness. So we're very concerned. That's why you started hearing about this ICU capacity in the last few weeks, that hospitals could fill up. So we started posting the ICU capacity on our dashboard for public health. As it stands right now, we're doing really well, but things can change quickly. We don't have a lot of ICU beds in our county. It's 28. It has gone up. It was 20 as of last week, but we've added 8. But that number is, when you think about it, it's still relatively small. And so a few beds filled up with either COVID patients or other patients, could fill those ICUs very quickly and max out our capacity.
We have about
We're
30
watching
seconds.
that very closely, and we're going to let everyone know if there's any bigger concerns. You can watch that on the dashboard. And finally, I'll just close out to say that we are now at a part of this pandemic where we know that there is a light at the end of this tunnel. A few months ago, I think if you asked any of us in public health, would we be here in December? I think none of us would have thought that we would be getting vaccine this week. As Senator McGuire mentioned, Monday, I got a text from Dr. Luskenhock from St. Joe's that we had the vaccine here. Yesterday, we went and administered the first doses over at Mad River Hospital. And I know they continue to vaccinate throughout the day today. And, we're working to get that vaccine out as quick as possible. So we are hopeful that will be a real game changer and let us start to dial back on the other measures that will help us contain this disease. So we really appreciate everyone's effort in this to protect our community and protect our loved ones. And we look forward to the end of this as much as everyone else and getting back to normal. And I think it's going to be a much better looking year in 2021. So thank you, Senator McGuire. Thank you, Mayor Long, and Superintendent Sinistero.
Thank you so much. That's Dr. Hoffman, the Public Health Officer for the County of Humboldt. We're grateful for your work. We're going to be taking questions, comments, concerns related to the report that we just heard from the doctor, or any issues that you have in regards to COVID questions. The doctor is here tonight to be able to answer them. And again, we are so appreciative that you have all joined us. I'm going to give a very brief state update. If it's all right with each of you, I'd like to be able to very quickly talk about where we're at in the state with our economy, our budget. I'd like to focus when we expect to see additional vaccine loads coming into the state, focus very quickly on fire, and then some very specific Humboldt County projects. So bottom line is this in regards to the state economy. We believe earlier this year, we hit the low point in our economy. We peaked at 13.5% unemployment. We're now at about 10% unemployment, slowly coming back. Humboldt County, though, Humboldt County is actually ahead of where the state is at. Humboldt County's unemployment now is about 6.6%, again, compared to where the state's at 10%, trending better than the statewide average. We believe that we're going to be in a recession for about 36 to 48 months. The most perverse part, though, of this recession that we're currently seeing, we're actually going to see a surplus at the state this year, anywhere between about $10 billion to $26 billion. And here's the reason. Those who have resources, those corporations that are based in California, those high wealth individuals, they're doing better than they have ever done before. And the biggest challenge that we have, both here in the state and across America, is that we have never seen a bigger wealth gap. So those who are successful versus those who are struggling, it continues to grow. But that is why we anticipate an actual surplus at the state of California this year. One of the biggest sectors that's been hit, as we all know, is tourism. And that is a significant driver for the county of Humboldt, as well as the state of California. We have had some bright spots in the economy. Unfortunately, it's on online retail. Mayor Long, 100% correct. It's so easy to be able to buy in Amazon, but it's so important to buy local because Amazon is not going to support the Humboldt Holiday Food Drive. But what we know is Grocery Outlet in Fortuna came through big time. They donated loads upon loads of non-perishable foods. So we have to continue to support our local merchants. The other bright points right now when it comes to the state, alcohol tax is way up. Cannabis tax is up significantly as well. We won't go there tonight, but you can see what folks are doing in this pandemic. Now, what are we doing with the budget? We have seen some significant reductions. We've had to make about $50 billion in cuts this year. Here's what we're not touching. We are not looking at cuts at K-12 public education. We're not going to balance the budget off of the backs of students and or teachers and classified employees. We have invested about $5.3 billion in digital divide dollars, being able to assist districts just like we see here in Fortuna, assist districts to be able to purchase tablets, to be able to purchase hotspots, to be able to purchase no-cost internet plans. We'll talk about specifically what has flowed both into the high school district and the elementary school district in state digital divide dollars in just a bit. In addition, we need to continue to invest in fire suppression, in CAL FIRE. So we are hiring an additional 172 CAL FIRE firefighters this year, 350 seasonal firefighters. That's on top of the 100 new full-time firefighters that we hired last year and about 150 seasonal firefighters. Look, we're also investing $200 million this year when it comes to all issues related to vegetation management and dead and dying tree removal. We have to get in prevention. It can't just be about response, which is why you're going to see such significant focus on dead and dying tree removal and vegetation management around communities that are under threat. Let's talk about the federal government really quickly. There's a lot of questions that came in about what the heck is the federal government going to do in regards to a stimulus package. So I'll be honest, right now, even as we speak in this community coffee, the House, the US Senate, and the White House are all meeting. The next coronavirus stimulus package will be anywhere between 900 billion and 1.5 trillion. That is a huge gap. I get it. But the Senate is at about 900 billion level. The House is at about the 1.5 trillion level. We hope that we meet somewhere in the middle. So here's the deal. They have to get this deal done by Friday. If they don't get it done by Friday, they have to vote to extend. The one good thing that I'll say is that no one wants to continue to haggle over the Christmas holiday, which we firmly believe they will come to a deal. So here are some of the hangups. Some of the hangups, liability for businesses. How is that going to be handled? So there's continuing discussion about liability for businesses. Number two, how much funding will go directly to cities and counties across the nation? They're still far apart on that. Here's what I think you're going to see. You're going to see enhanced unemployment benefits coming from the federal government. We probably won't see additional $600. They're right now discussing about $300 in additional unemployment benefits per month. There's been a lot of discussion about, are we going to see additional stimulus checks coming from the federal government? Yes, they're focusing on that. And rather than wait for the 2020 tax returns to come in, they're looking at going back to the 2018-2019 tax year to be able to use those so they can expedite direct stimulus checks into the hands of Americans and Californians. And that is, candidly, our GDP in this state and across the nation went up when they did direct stimulus checks to everyday Americans. So that is also most likely going to be in the bill. Finally, what we know for sure will also be in the stimulus bill, dollars for states to be able to get the vaccine distributed, dollars for states to be able to continue to fund the digital divide, bridging the digital divide, which is going to be absolutely critical here as we move forward. So let's talk quickly about the coronavirus and the pandemic and where we're going as a state. So on the coronavirus, there have been two major priorities that we've had. One, we have to expand testing across the state. So up until about a month and a half ago, we were doing about 140,000 tests every day through state-sanctioned testing sites. That's not acceptable. We need to get to a minimum of about 250,000 tests. So we went out and actually purchased a new 100,000 square foot lab space, which we're now ramping up. By the end of November, we were able to expand another 40,000 tests a day. By the end of December, we'll have 100,000 new 100,000 processing tests a day. So we'll get up to about 250,000 tests just happening on the state side, not including some of the private labs that we're contracting with. So that's been a major focus. Now, on the vaccine, it's a little confusing and it shouldn't have to be like this, but I just want to break it down about where we're at. This first phase of vaccines are only going to go to healthcare workers. So right now, on California soil, we have 327,000 doses of the Pfizer vaccine. That will be used quickly. We anticipate by Christmas Day, December 26th, we're going to have another 600,000 doses of the Moderna vaccine. Both vaccines require 2 shots. If you get the Pfizer shot, it's 21 days apart. If you get the Moderna shot, your second one has to be 28 days apart. So we are very focused on working with the federal government to be able to get that full dosage of 2.4 million in. We believe that it's going to take another 30 to 60, potentially 80 days to be able to get all 2.4 million healthcare workers in health centers, hospitals, in convalescent homes, also in prison, healthcare workers in prisons and jails, you name it, probably another 2 to 3 months to be able to get that all done. And at the simultaneous side, we're looking at what this next phase after phase 1 will be, and we'll have more to report here in the next few days to a week. But that is a major critical issue that we're focusing on. And I promise you that is top priority, getting this vaccine in and distributed. And if you can, we're having a big coronavirus town hall tomorrow night at 6:30, where we're going to have the vice chair of the vaccine task force on, Lori Missoura. She will be talking about the actual timelines they meet tomorrow. We may have more to report as early as tomorrow evening. Fires, quickly on fires. 4 million acres were burned in the state of California this year, more than any other time in our state's history. The wildfires in California and the West are getting worse. Larger, more destructive, they're burning hotter. We know, according to the federal government, the United States Western state wildfire season, Rockies West, it was 172 days in the 1970s. Today, it's 222. We also know that the temperatures in California have gone up, according to NOAA, 1.5 to 2.5 degrees since the early 1970s. Now, climate change is a significant factor on why we're seeing expanded wildfires, but it's not the only factor. We're coming out of the largest drought in 1,200 years. We're building more in the wild and urban interface. And the other challenge that we have 100 to 120 million dead and dying trees in the coastal range, as well as in the Sierra, which is driving how fierce these fires are. Finally, and I want to get to your comments, that's the most important part of tonight, quickly on some very specific Humboldt County issues. Number one, what is really upsetting to me is that we are one of the only regions in the entire state of California that didn't have a Bachelor's of Science in Nursing program at our Cal State University at HSU. As we all know, back in the mid-2000s, the Bachelor's of Science in Nursing program was cut due to budget cuts at HSU, simply unacceptable. We were able to work with HSU to raise $5 million, $5 million, $2 million of that, by the way, came from St. Joseph's Health, to be able to relaunch the Bachelor's of Science in Nursing program at HSU. The first 13 students are now in the HSU Bachelor's of Science in Nursing program. We'll go to 25 next semester. And here's the other cool part. We've created a pipeline for nursing jobs. We've launched a new licensed vocational nurse to registered nurse program up in Crescent City. So we already have one at the College of Redwoods. So you'll be able to see RNs getting their bachelor's degree at HSU from the campus of the College of Redwoods in Humboldt, and now also in Del Norte County. It's really critical because it's about creating family sustaining wages here in Humboldt County. And it is absolutely ludicrous that someone would have to drive 5.5 flipping hours to Sonoma State to go get their Bachelor's of Science in Nursing program. We need it here locally, and we finally have it. Quickly on mental health, 2.5 million. We've secured 2.5 million in expanded mental health funding for local schools. That 2.5 million will be invested for expanded counseling. It's a 4-year grant, suicide prevention, and also focusing on low-income kids in school districts throughout the county. That is really critical. We mentioned those digital divide dollars to be able to purchase laptops and tablets, hotspots, low cost, no cost internet plans. About 700,000 came into the high school district. About $1 million came into the elementary school district in Fortuna. I will be honest, and you heard that from the superintendent, everybody needs a tablet right now. So our biggest challenge is we've actually had the money. but everything is back ordered. So that has been a real challenge for us. Homelessness. Humboldt County has the highest homeless population per capita in the state of California. And what I will share with you is it is absolutely unacceptable that rural California has these challenges, yet the state hasn't invested. Well, I will tell you, times are changing. And that has been one of the top priorities of mine, is making sure that we have the resources that we need to be able to overcome these challenges. So just this year alone, we've secured $4.3 million to be able to build 48 units of permanent supportive housing. This is a partnership with St. Joe's. We've purchased the Humboldt Inn in Eureka. It will be run by St. Joe's, and it will provide permanent supportive housing for individuals who are homeless. We'll also have wraparound services to drug and alcohol addiction, as well as mental health. The Yurok tribe also secured $2.2 million to be able to purchase a hotel, 18 units. 25% of those will be dedicated to Native American residents in Humboldt County. We have some of the highest opioid addiction rates in California. We've secured just under $4 million to open up a brand new opioid health center in Eureka. Aegis is now open. It's down on the waterfront. It's critical that we got that open. They're through their licensure process. That will open up about additional 250 patient slots for Humboldt, Trinity, and Del Norte counties, which is absolutely critical. I have gone on way too long. It is now time, which is the most important part of tonight, is hearing from each of you. Again, if you'd like to be able to ask a question tonight, hit us up, senator.mcguire@senate.ca.gov. I want to say thank you to Judith. Judith, you have been so incredibly patient. Judith raised her hand about 45 minutes ago, and she's wondering what the heck is taking so long. So let's go to Ms. Weiland for our first question, and we welcome you, Judith, to our community coffee. Thank you so much for taking time. Oh, Judith, we're gonna have you take yourself off of mute.
Actually, the question got answered, so let's pass. I submitted a response question, which I would hope be addressed later on.
Thank you so much. We'll be going to that here in just a moment. Judith, thank you so much for joining us, by the way. It's good to see you.
Sure.
Thank you. All right. We have several emailed questions that are coming in. If it's all right, we're going to go to your questions here in person in just a few moments. But let's go to our first question that came in for Amber from Fortuna. This is going to be going to Dr. Hoffman, our public health officer for the county of Humboldt. Amber asks, is there any sort of local community plan for COVID testing, vaccination of local school employees? Now, Dr. Hoffman, this has been a hot topic across the state. When school employees will be vaccinated, there's going to be a big push. Please push back on me if you think I'm incorrect, Dr. Hoffman, to be able to go into this second phase after healthcare workers. It's not decided yet, but Dr. Hoffman, I'll turn it over to you as the expert.
Yeah, great question, Amber. You know, it's certainly part of the plan. And as you all know, I mean, this is all happening as we do it. So we keep saying we're building the ship as it's sailing. You know, the fact that, like I mentioned, the fact that the vaccine's already here is a big surprise to a lot of us. You know, that beyond tier 1A, which is the first priority of the healthcare workers, we just can't say at this point when the next tier is going to come out. And there's so much debate going on right now. There's a lot of stakeholders, everyone's talking about it. But I have good faith that it's going to make sense when it comes out, based on what we've seen so far with tier 1A. So, you know, certainly before then, testing is definitely a plan. I mean, Superintendent Semestero mentioned that there's no transmission in the schools, and we know that from a lot of different studies. If we do schools right, if we practice safe practices with masks and distancing, and the schools are set up properly, and we have access to good testing, it's not that kids won't get COVID. Of course they might get COVID, but they're probably not going to get it at school. They're going to get it outside of school, just like the rest of us. So the school, if it's done right, can be a very doable setting. And it's, you know, Dr. Frankovich before me had worked hard to try to get schools open. I think, if we're going to open anything, it's schools, because we want the kids to get back in person when everything is safe. So
Dr.
that,
Hoffman,
so
we're going to need to go to our next question. I don't mean to cut you off, but please go ahead and finish up your thought, because we just have quite a few questions coming in via email. Please, Dr. Hoffman, fire away in your final thought.
I think my final thought was really just talking about the vaccine and just briefly why we're focusing on 1A with healthcare workers is, if our healthcare worker, we've had to take out a lot of healthcare workers, and that greatly impacts the flow of patients through the healthcare system. Just to give you a small example of that, our local mental health acute care facility has currently an outbreak. And if that place shuts down, it's going to affect not just acute mental health, acute psychiatric services, it affects everything in the healthcare system. Those patients have to get rerouted to other places. So it's like a domino effect. So we're starting there because it's an important foundation for treating our patients with COVID and everything. And we will move forward with our best intentions of getting everyone the vaccine as soon as possible. Thank you.
Thank you so much, Dr. Hoffman. Dr. Hoffman, we're going to go to a quick question from Carrie. Your gut, Dr. Hoffman, I know you're looking into your crystal ball on this. We think at the state, 2.4 million folks, hospitals, health clinics, et cetera, administering the vaccine in their own walls, right? We think it's going to take 2 to 3 months to be able to get 2.4 million folks vaccinated. Carrie asks, how long do you think it's going to take to immunize all first responders in Humboldt County? What's your gut, Dr. Hoffman?
Yeah, well, Senator McGuire's talking from a statewide, we're working locally with all of our local healthcare providers. I can tell you that it's likely that we could have here in Humboldt County our Tier 1A done much sooner. It all depends on the flow of the vaccine, but this is a great community. Everyone is working together just like we've done all along, and so it'll happen as fast as possible. I think we could easily be working through Tier 1A as soon, depending on supplies of vaccine. If the vaccine keeps flowing at the rate it is, we could be there in January. So, we're in a really good position, I think, right now. But it is a crystal ball, as Senator McGuire said. I just, I'll say one other thing on the vaccine. There were 4 sites in California that got vaccine on Monday, and we were one of them. And that was because of the dedication of our team to make sure that they understood the nature of our community, a rural community, diversity in, of geography and a wide diversity of our population as well. So that, it served us very well here in Humboldt.
Absolutely. And Humboldt also got the first coronavirus testing site in the entire state of California as well. And again, thank you so much, Humboldt County. Alyssa, she has a comment. She wants to know what our office is doing to be able to advocate. I'm paraphrasing here, to advocate to county public health as well as state public health to ensure that educators are going to be in that second priority tier. Look, Ms. Maury, I think you're spot on. It is going to be absolutely critical. We will not get back to normal in our economy until we're able to get kids back in school and school staff vaccinated. My wife, she is an elementary school principal. The superintendent, you can talk as well on this. I think it's going to be absolutely critical. But here is where I'm going to be squishy, and I don't mean to be squishy with you. It is all going to be dependent on the flow of vaccine and how many additional vaccines manufacturers will see their specific vaccine approved. So right now we have a Moderna and a Pfizer, and all we know for sure that's showing up by Christmas is another 600,000 cases of Moderna. So that gets us in 927,000 doses. We need to get to 2.4 million. So that is why I think we're going to hear more tomorrow from our vaccine task force on additional times and start having a conversation about who will be in that second phase. my own personal opinion, I am not a doctor nor a public health professional. We have to be able to safely and strategically get our schools back reopened. That's why I do believe that we need to look seriously at prioritizing public school employees. So that's where I'm at, but we're gonna have to wait and see where the feds and the vaccine task force comes through. All right, why don't we go to another question here live on Zoom. If you'd like to be able to ask a question, have a comment, feel free to raise your hand right now. Turn on that camera, raise your hand, question, comment for anyone here on Zoom or scrolling through the galleries. Anyone else has a question or comment? Otherwise, we're going to go to our next question. All right, we're going to go to Jason. Amber, what's going on? Jason, Amber, thank you so much for joining us. We see the Christmas lights in the background, and I think we saw Munchkin as well walking around the house. How's it going, you guys?
Going good. I have a question for the doctor, and my question is about vaccines and the fast tracking of the vaccine. And I have good friends that are in the biotech industry and have told me that, you know, best case scenario, a very fast production on a drug or a vaccine is 5 years out. And here we are less than a year later, and we're cranking this thing out. I have serious reservations about how the quality of the vaccine and whether this is, you know, the question's obviously out there is, you know, whether it's money driven and just, you know, how good is it? And so just Dr. Hoffman, what are your thoughts on that?
Jason, that is a fantastic question, and I'm really glad that you brought it up. You know, I'll be honest, I was really skeptical of this whole plan as a physician and a scientist. I mean, I started my career working in labs, doing bench research before I went to medical school. So I'm well aware of the length of time it can take for these things to happen. And so I was telling everyone, yeah, don't expect it until, you know, sometime in 2021. The truth is, though, that this vaccine technology had been worked on for a while. We just had not seen it yet because there hadn't been a need for it. But they had been working on it for other things like cancer research. And so when the coronavirus came around, they pivoted very quickly to use this novel strategy of the mRNA, messenger RNA, to produce a quick response. And the reason that it used to take so long to find the right protein for a vaccine is that you have to make sure that that protein doesn't interact with other parts of your body so you don't get a bad reaction from it. Because they're using a genetic code, they could actually go in, figure out quickly what the most important code was, put that into the vaccine, and now your body produces the protein instead of injecting the protein, and you get a good immune response. And so it happened really quickly, I agree, but I've personally reviewed all of the trials myself. I didn't want to give the first vaccine in Humboldt County without doing that first, so I made sure that I knew, because it's on me. I'm the health director for the county. So I personally read them all. You know, I talked to all the right people. I read through all the FDA, you know, all of the authorizations, all the papers, and I feel very confident. This is a safe vaccine, and it's actually way more effective than I ever could have imagined. I mean, 95% efficacy is fantastic. So I'll be signing up for it as soon as my tier is up. Hopefully, but you guys get it before me, you teachers out there, because you need it before me. I'm not seeing any patients right now, but when we get to that stage, I will absolutely be getting it. And you know, if you want to live stream it with me, Senator McGuire, we can do that.
All right, you heard it. Dr. Hoffman is going to take the vaccine and he's going to live stream it. So you got that commitment. Thank you, Dr. Hoffman. Very grateful. Jason, Amber, so happy that you are with us tonight. Thank you very much. Feel free to chime in here again if you have any additional questions. We're now going to go to the mayor, Mayor Long. This comes in from Michael. Michael is requesting updates on the Kinmar 101 project and pedestrian safety. Mayor Long.
So I touched on that a little bit in my opening statement. We are in the design phase of that. We are working with Caltrans And again, that's probably going to take about a year. We have funding for the design only. And then when it comes to construction, we're going to be going out for funding and grants and whatever we can find to actually build the exchange. And so it's down the road a ways, but we are working on it and we hope to be making progress.
Thank you so much, Mayor Long. We are getting several questions like what Renee has submitted. Renee submitted a question about federal aid and what families can expect to see in the form of an aid or a stimulus package from Congress. Again, the last thing I want to do, the last thing Mayor Long ever wants to do is give a squishy answer, but I'm just going to be truthful. Tonight, they're negotiating. We don't know what that final federal stimulus package will be. As we talked about earlier, they have a Friday deadline to be able to get this damn thing done. And honestly, we got to get them to work. We got to get them to work together, put aside partisan differences, and put the interests of struggling Americans first. I hope that both parties are going to be able to do that. I'm fairly confident that we're going to be able to see them move on getting a stimulus package passed that will be focused on small business relief. So what they're talking about is extending the PPP program for small businesses, for businesses that have already received it, and opening up a new funding allocation for potential businesses that did not. And they're looking at enhanced unemployment benefits and direct stimulus checks to the American public based off of annual income. Again, I'm not trying to be general with you. It's just we're waiting to be able to see what the federal government will do. Negotiations were happening tonight with the House of Representatives, the U.S. Senate, and President Trump's administration. More to come on that. And I apologize, I don't have any more information, but it is critical for all 50 states and it's critical for this nation's economy. Let's keep going. A lot of questions coming in for Dr. Hoffman. So Dr. Hoffman, all right, we're getting a lot of questions about going back to normal. When are we going to have in-person events again? That's what Tina asks. Samantha has written in, how are we going to get back to normal way as well, especially if folks refuse to take the vaccine? So 2 questions for Dr. Hoffman. First and foremost, again, Dr. Hoffman has brought his crystal ball tonight. There we go. He's ready to go. When do you think we're going to get back to in-person events again? Number 1. Number 2, when do you think we're going to have some sense of normalcy here on the North Coast? And what happens if we have higher than normal opt-out rates? Dr. Hoffman.
Yeah, well, like I mentioned already, the vaccine is an extraordinarily important tool in this. You know, we've had other tools up to this point with masks and distancing, being outdoors preferably, and then our public health measures with contact tracing, with lots and lots of testing. I mean, I think all of those things will continue well into 2021. But the vaccine is the thing that could change that. I mean, if we think about what the vaccine has the ability to do, is that hopefully it will, number one, the use of it is really to keep people from getting sick. So we're not giving it to reduce transmission among people. We don't know if it does that or not yet. We're hopeful that it might, but what we do know is that if we give it to you as an individual, that you will not get as sick or maybe not sick at all. And if you do get sick, it'll be more mild. So that's going to help our healthcare system stay open longer. It's going to not have people like our healthcare workers have to be out as much so that everything flows through the system better. And that allows everything to stay more open. Now, if it looks like it does reduce transmission, which many of us are hopeful for, but we don't have evidence of it yet, that'll be the real game changer. So I would look for that in the coming months as we study this vaccine a lot more and we get data on whether or not it can reduce transmission. Until we know that it can reduce transmission, it means we're going to be masking, we're going to have facial coverings, we're going to need to continue to distance. And I think that over time into next year, maybe summer, hopefully summer, we can dial back on some of that stuff and start to see gatherings, again, they might still have masks, but we might feel more comfortable with gatherings outside that are larger than what we've felt comfortable up to date. So that's sort of what we're thinking in terms of that.
That's Dr. Hoffman. He's the County Public Health Officer here in the beautiful county of Humboldt. We're taking your questions. We're getting several coming into the email. We have about 10 more minutes left, and we are so grateful that all of you are with us tonight. If you'd like to be able to submit your question via email, feel free to hit us up at senator.mcguire@senate.ca.gov, senator.mcguire@senate.ca.gov. We look forward to hearing from you. Let's go to our next question here that has been submitted via email from IMS. IMS asked the superintendent, Mr. Superintendent, what benchmarks would lead to the high school district to go full distance learning as the COVID pandemic continues to spike locally, Mr. Superintendent?
Well, thanks for the question, Senator McGuire. And I would just say that, it's a hard decision for me to make because I'm not the decision maker in that. As I talked about before, the district is ran by a board of directors, board of trustees. So it would be difficult for me to comment on that. But, we've been pretty lucky so far as Dr. Hoffman said too. There's been 0 transmissions at school. We've only had a few kids that have been tested positive that we've been able to, exercise our plan that we have and everything like that too. And as mentioned before, it's ever evolving. So again, as you were saying, I'm not to duck the question, but it's just a question I can't really answer because I'm not the decision maker of the district. So I appreciate the question.
And you're in constant communication with public health as well, right, on that issue as well. I know we had a all call with superintendents from Humboldt and Mendocino County, and there is more collaboration now than there ever has been with local public health departments. Would that be accurate, sir?
Yeah, and I think what Dr. Hoffman's done that really helps the schools is that Dr. Frankovich, when she's stepping back from her back to her part-time role, she's kept her working with the schools, and so we're able to keep that constant communication going, and also she knows the history of when we started and everything like that too. So that's really been helpful. And as you know, and I think Dr. Hoffman would agree, is that the school system is kind of a separate entity on itself. And so being able to have that historical knowledge with her really helps for that. And I think since the beginning, we've developed better and better processes for things to be able to do that with the notifying and the testing and so forth. So again, I think to that point, each and every day that passes, we know more and more information and we're able to make better decisions and I think better actions to be able to curb the transmission.
Thank you so much, Superintendent. We're very grateful for that answer. Ladies and gentlemen, we have just a few minutes left. I am seeing a dog with Jeremy right now. My goodness, that is too cute. Is that a Cocker Spaniel? All right, Jeremy, you got to tell us what type of dog do you have and what's the dog's name?
This is Leo. He's a Shih Tzu.
A Shih Tzu. Oh my goodness. Leo is a cutie. Are those ears or is that hair?
That's all ears.
Wow. That is fantastic. I think one of the Zoom attracts cats and dogs. Mai, who was here, I was on a call with Mai earlier. Her cat attacked her face on Zoom. I don't know what is going on with cats and dogs, but they love Zoom. Thank you so much, Jeremy, for showing off the dog. If you have your pooch tonight, we would love to see it. Bring in your dog, Mayor Long. You have a dog with you here tonight?
I do.
All right, so we're going to see Mayor Long's dog. I'm going to show off my pug before we're done. So it is good times. Look at that. So Jason and Amber, what type of dog is that?
He's a German Shepherd.
A German Shepherd. Is he older? I see some gray there in the muzzle.
He is. He's actually paralyzed, and but he's been paralyzed for about a month and a half, but he's doing really good.
Oh my gosh, what's his name?
Bruno.
Bruno. How old's Bruno?
He's 11.
Bruno is kicking. I love it. Thank you so much, Jason. That's great. All right, Mayor Long, tell us about this cutie that you have.
This is Dixie, and she is half Chihuahua, half Yorkie. So she's about 13.
What a cutie. Look at that face. And just a sweetie as well, Mayor Long?
She is. She likes to be wherever I'm at, sitting on my lap. That's her life.
I love that. All right. Well, you're gonna show off your cat, your dog tonight. If you have one, we'd love to see it. We have a few more questions. A question came in from Joan. What can be done to hurry Caltrans along on the relocation of Highway 101 south of Crescent City, known as the Last Chance Grade? Joan, thank you so much for your question on that. This has been a big priority for us. So here's where we're at. So over the last 2.5 years, we secured $50 million. $50 million that's going into the geotechnical study as well as the environmental impact report. It is some of the most unstable soil that we have in the nation, as you all know, on the Last Chance Grade that connects Humboldt and Del Norte County, and candidly, the rest of the state with Del Norte County. We believe that we're going to be able to shave some time. We're expediting this geotechnical. It's on time, on budget right now. Ultimately, here's my prediction. I think we're going to be able to shave some time off of the environmental and the engineering to be able to get to a preferred project. And then we're going to go work on securing those dollars. It is one of our top priorities to be able to get an inland route of the Last Chance Grade built, coming off of the coast, pushing it inland. I want to say thank you to Caltrans. Sincerely, they are making this a significant part of the top priority of the Caltrans district. And we have the money in the bank to be able to move forward on this important first phase, which is absolutely critical. We're going to go to Mayor Long. Mayor Long, you mentioned cannabis in the beginning. We've had some questions coming in about cannabis in Fortuna. So I know that you said because of COVID, the workshop was delayed. Why don't you give us an update on anything else that you could predict for 2021? Do you think that workshop will be rescheduled? Why don't you give us an update on that? I know you touched on it in your opening remarks.
So as soon as the county gives us the okay, or the health department or whoever's in charge of telling us what to do, and we can have public council meetings, and we can have our public, either whether it's outside in the park and we're all spaced apart or whatever it is, but as soon as we can have a gathering big enough to hear all of our constituents, our citizens, as well as the people that we would need to come and speak on the subject, the experts, the people who are involved in that business, it's going to be a big group. It's going to be a big gathering. And so until we are able to accommodate that many people in one place, we're kind of stuck.
Got that. Thank you so much, Mayor Long. Mayor Long commenting on all issues of cannabis. We are going to be with you for a couple more minutes. We're going to do a last call for questions coming in via email. Senator.McGuire at senate.ca.gov. Last call for questions via email. Let's go to Zoom right now. Do we have any questions or comments for any folks who are currently on Zoom? This is going to be our last call for folks who maybe it's good to see Orville and the entire Garrison household. How's it going, you guys? Nice to see you. Let's do a last call for any questions that may be on Zoom, and we'll go to our last few questions on email. Any last questions on Zoom? All right, Dr. Hoffman, you have been popular tonight. So here we go. Talk to us about how the vaccine is going to be distributed. Jennifer's asking this. So right now for healthcare workers, the healthcare institution, so if you work for a hospital, the hospital is giving out the vaccine to their own employees. How's it going to work? How's the vaccine going to be rolled out? And where will people get vaccinated as we move forward into the next tiers? Dr. Hoffman.
Yeah, great question. So again, building the ship as we sail it. So don't take anything I say as firm ground. But here's some things that we would envision. I think that, well, there's a couple of points. One is that the Moderna vaccine, once we get it, is going to be much easier to handle. So it's going to be able to go to a lot more places. So I think by the time we're in, even 1B and certainly by the time we're in phase 2, we're going to have a lot more stable vaccine that you can just go to your doctor's office. So most of us would probably just get it at our doctor's office. Certainly there's a chance that we could have mass vaccination clinics at local, large, at the hospitals or some other place like the fairgrounds. It's a possibility. We haven't really gotten to that point yet. I think the other likelihood is, pharmacies are signing up to be Vaccinators, many of you probably already get some of your vaccines at a pharmacy. So they're going to start vaccinating the skilled nursing facilities. So they're going to have a first go round with experience with the vaccine. So we fully expect that they will continue that once it gets to the community level. So that will be another route for people to get their vaccine. So there's going to be a lot of different ways. And it really comes down to the flow of the vaccine, as Senator McGuire said earlier. How quickly can we get it? Because as soon as it hit the ground here, we started getting it in arms. That's our goal. We don't want it to sit around and get stale.
Thank you so much, Dr. Hoffman. Dr. Hoffman, we're going to go to one last question for you. Then we're going to ask for some closing comments from the mayor, the superintendent as well. And I want to address a question that Julie has sent in. So Steve writes in, Dr. Hoffman, there are concerns about the ICU capacity criteria for the governor's expanded curfew stay-at-home order and the manner in which the regions are determined for this purpose. So please push back on me. What I think the governor was thinking, the state was thinking, is they've batched the regions into public health officer regions on where the public health officers work together. Northern California, Bay Area, San Joaquin, Central Valley, Sacramento, as well as the greater LA region. So Steve believes that counties like Humboldt with higher capacity are being negatively impacted by those with lesser capacity or those that have already exceeded their capacity. Can you talk about this issue as well, Dr. Hoffman, and your thoughts?
Yeah, I know you guys are asking all the right questions. I love this group. So as I mentioned earlier on, this ICU capacity is a really difficult thing to wrap our heads around. So we decided a couple weeks ago to start putting it up on the dashboard because we knew it was going to be important, but we also knew it needs some explaining. It's not like you can just look at that number. And so you might look at it today and see Humboldt County has 50% ICU capacity, and that sounds great. But last week we had 10%. That was just a few days ago. So it fluctuates wildly from day to day. I honestly, myself and the other health officers, don't put too much on that number and its fluctuation. We're paying attention to what's happening in the hospital. So we talk to the hospitals every day. We get updates from them, and we talk to the other health officers in the region. Met with them this morning at 7 in the morning, met with them over the weekend on Saturday. So we're talking amongst ourselves. I think that the numbers, they matter to a certain degree, but what really matters is our coordination with our local hospitals and knowing when is the right time, when is too much, when is that capacity of the hospital really so thin that we probably should pull the trigger on stay-at-home orders. And whether or not that's tied to this regional thing, I mean, we can all debate it. It is what it is. It makes sense to a certain degree, like Senator McGuire said, because we all of us in the Northern California region, we meet at least once a week, often more, and are talking to each other, and the flow of patients does tend to go in the direction of these other counties. So we share regional resources among the hospitals and among the counties. So, I wouldn't characterize it that way, that we're being negatively affected per se. If anything, today, we're helping everyone else out because we have 50% and they have less. So tomorrow it might be, last week it was the opposite. We had 10% and other counties had 50%. Mendocino had 80%. So,
all right.
But look out for, what I'd say for everyone is just watch what we're saying, because if we feel things are getting too thin here, the hospitals are going to let us know that there's not enough hospital capacity, and we're going to let the public know, and it's going to be a discussion.
No, that's Dr. Hoffman, the County Public Health Officer. Thank you so much, Dr. Hoffman. We're going to be going to closing comments, and we are so appreciative of all of you taking the time. I do want to address Seth McGrath. Look, Mr. McGrath has been so incredibly supportive of the Humboldt Holiday Food Drive. He helped out the Huskies here, Fortuna High School, brought in a load of food to be able to support Fortuna High. He has a question in regards to discontinued recycling, and that he received a notice that's going to be $100 per day fine because we don't have the recycling centers open. I'll be honest with you, Mr. McGrath, this is going to be one of the top issues that the state is going to address. Is we have a broken recycling system. We're one of less than 10 states in the union that don't have the manufacturers doing the recycling, where we have a public program. I think you're going to see a flip on that. Mr. McGrath, if you'd be willing, just because I think it's going to be a longer conversation, thank you for your involvement in this. Would love to be able to give you a call to be able to talk further about this and get your feedback, because that $100 fee per day is absolute ridiculous. I almost swore, but we'll call you, Mr. McGrath, on that if that would work for you. And Mike Johnson, who is on this line, will also assist on getting us time to nail down. And thank you so much for your generosity. And that is why we also need to shop local, ladies and gentlemen. All right, ladies and gentlemen, I just saw Judith. Judith, I saw a pooch get into your Zoom. Am I right, Judith? Oh, two of them. All right, that looked like a chihuahua. Am I right, Judith? All right, we got a chihuahua right there. All right, hey, I'm going to show you Gertrude. Here we go. She is always at my feet. This is Gertrude the Pug. She's really good at inspecting garbage cans, sleeping, and eating. That's about it. So it's good times right there with Gertrude the Wonder Pug. All right. You all are saying, why did I tune in tonight? I'm really grateful that all of you would take the time. I want to give you our email once again. Please, anytime any issue comes up with the state, please call us. You can reach us at 916-651-4002, 916-651-4002. You can always email me, senator.mcguire@senate.ca.gov. We'd love to be able to hear from you on any issues. Mr. McGrath, I look forward to speaking with you on all issues of recycling. We're going to be, you have been so incredibly patient. We're almost at about 2 hours. Thank you for your patience. We're going to turn it over for closing comments. First from the doctor, then we're going to go to the superintendent, then we're going to go to the mayor. Dr. Hoffman, closing comments, please.
Yeah. Oh, thank you, Humboldt County. It's a wonderful county that I first fell in love with about 15 years ago when I first came up here with my future wife at the time, and I was so happy to be back here. You know, you guys should know that this effort in public health has really been outstanding from the point of it's a shining star in the nation, really, the public health department here in Humboldt County, keeping us safe. They were doing more, Senator McGuire alluded, there were more tests here in Humboldt County in the early days of the pandemic than they had where I was practicing in the state of Oregon, had less tests for the state of Oregon than we had here in Humboldt County. So it's a wonderful time to be here, and I appreciate all your support and your help. Thank you.
Thank you so much, Dr. Hoffman. We're going to get through this because we're going to work together. Very grateful for your work, sir, and happy that you are in the position that you're in now. Let's go to our superintendent from Fortuna Union High School District. Glenn.
Yeah, I would just say thanks, Senator McGuire, for allowing this opportunity for our community members to be able to ask questions and take part in this. Again, I would echo what Dr. Hoffman says. We live in a great place. We're fortunate enough to be able to work here, raise families here, and things like that too. I would just say that we at the school district appreciate the trust that you have, that the community has in us to serve the kids, and we don't take the safety and well-being of our students lightly, and our community as a priority. And we've worked hand in hand with Dr. Hoffman's Department of Public Health, and we will continue to do so. And so we're very gracious for you allowing us to be able to educate your kids, and we look forward to continuing that.
Thank you so much, Mr. Superintendent. We're really grateful. And we want to just, again, take a moment to say thank you to Mayor Long for her incredible commitment to the city of Fortuna. She is fabulous. She does a great job on your behalf. Mayor Long, why don't you close us out for final words?
Well, thank you, Senator McGuire. We really appreciate your time. The rest of the panel, all of you that joined us. I know that there may be questions that didn't get answered tonight. You can call me if there's something that's really weighing on your mind at 599-6826. Once again, that is 599-6826. You can also call City Hall and get email information. So if there is questions or things that are hanging over that didn't get resolved tonight, please let us know that. Our job is to serve the public and to listen to the public, and that's what we are all here to do. I appreciate all of the people who are brightening up Fortuna by joining in our Dazzle contest. Don't forget to vote. Everybody have a Merry Christmas, a Happy New Year. Hopefully things are going to look a lot brighter and better in 2021. Thanks for joining us.
Well said, Mayor Long. Thank you so much. We are so appreciative that each and every one of you have joined us tonight. We want to say thank you for your questions. We got quite a few answered tonight, not all of them. We apologize. Please email us if you have any issues on any state-related items, senator.mcguire@senate.ca.gov. We'd love to be able to hear from you. A few thank yous. I want to say a big thank you to the mayor, to the public health officer, to the superintendent for taking the time out of their busy schedules to be with us tonight. I want to say thank you to each and every one of you for your willingness to be able to come out here on a Wednesday evening and join us from your living rooms. It was a lot of fun seeing your dogs as well. And finally, I want to say thank you to Mai Johnson, who was on tonight. She manages our Humboldt County office. Really, really grateful for all of her work. I want to say thank you to Carrie, Jason Lyles, and Dana, who are behind the scenes, making sure that everything was smooth tonight. And I want to invite you to be able to join us tomorrow. Tomorrow at 6:30 p.m., we'll have one of the top infectious disease doctors in California with us tomorrow night. We'll have representative from the Public Health Officer Association, as well as the vice chair of the State of California's Vaccine Task Force. We're going to be focusing on vaccines. We're going to be focusing on all issues related to the coronavirus and what to expect in the months to come. 6:30 tomorrow night. The link is in the chat right here. You could also visit our Facebook page. Just search Senator Mike McGuire. Thank you for allowing me this opportunity to be able to work with you each and every day in Fortuna, in Humboldt County. I know it sounds cheesy and I get emotional talking about it. It's the best damn job that you could ever ask for. And I want to say thank you for allowing me to be able to work with you each and every day. Hope you have a wonderful Hanukkah, a Merry Christmas, and here's the better days in 2021. Thanks so much for joining. We really are grateful. Have a wonderful holiday, everybody. Thank you so much. Mayor Long, Doctor, Superintendent, thanks y'all. We'll talk to you soon. Thank you so much. Bye, everybody.
Thank you.